anal warts, also known as anal condyloma, are small lesions that are found on the skin around the anus or just inside the anus. This area is called the anal canal. These bumps or lesions are also sometimes found on the labia, the scrotum, and the penis. Anal warts are caused by the human papillomavirus, also known as the HPV virus. Infection with the HPV virus is very common. The HPV virus is spread from person to person via direct sexual contact. If you have anal warts, it's recommended that you either abstain from sexual contact or use safe sex practices such as condoms. Anal warts can be both very small lesions as well as larger, extensive lesions. They can cause a variety of symptoms, including itching, burning, bleeding, as well as a mucus discharge from the area. Anal warts are diagnosed with a good physical examination of the area. This is done by a doctor who looks at the anus and the tissues around the anus, as well as an exam of just inside the anus. This is often done with a small scope called an anoscope and is usually done in an office setting. Most of the time, the diagnosis is made just by looking at the lesions. The bumps themselves can often look like small cauliflowers. Sometimes a biopsy is required to confirm the diagnosis. So there are many options for treating anal warts. Small lesions can often be treated with procedures that are done in the office. This involves either removing the wart or freezing it off in the office or applying a medication that burns it off. Sometimes we prescribe a medication that will help remove the wart that you take at home, and this is a medication that you apply to the skin around the anus. For larger lesions, they sometimes require that they be removed in the operating room. For very large lesions, this may need to be done in stages. For almost all of these types of operations, they are outpatient surgeries, and patients will go home the same day. If tissue, particularly large amounts of tissue, is removed, this will be checked for the small possibility of a cancer within the warts. After you've been adequately treated, your doctor may wish to perform several follow-up exams. This is done for several reasons. First, recurrence or a return of the anal warts is unfortunately common. By monitoring things in the clinic, your doctor may be able to find the lesions at a smaller stage, and therefore they may be more easily treated. Additionally, patients who've had a history of anal warts are at a small increased risk of anal cancer in the future and therefore may need to be monitored. Colon and rectal surgeons are experts in the surgical and non-surgical treatment of diseases of the colon, rectum, and anus. They have completed advanced surgical training in the treatment of these diseases as well as full general surgical training. Board-certified colon and rectal surgeons complete residencies in general surgery and colon and rectal surgery and pass intensive examinations conducted by the American Board of Surgery and the American Board of Colon and Rectal Surgery. They are well versed in the treatment of both benign and malignant diseases of the colon, rectum, and anus, and are able to perform routine screening examinations and surgically treat conditions if indicated to do so.